Well, even as the number of coronavirus cases in the state of Tamil Nadu is on the rise, the state government has now decided that instead of going for the rapid test kits, they will straight away opt for the RT PCR tests instead, which is more confirmatory in nature. Remember, 4 lakh rapid test kits are still awaited, but the government of Tamil Nadu has now decided to go ahead with the RT PCR test. Now, already a lakh of RT PCR kits are available with the government. An additional 20,000 kits are being provided by the centre. Remember, Tamil Nadu, being one of the worst affected states in the country, has as many as 558 containment zones and 22 districts identified as hotspots. So, RT PCR confirmatory tests will be now conducted in these areas that are identified as hotspots to check the coronavirus infection. But remember that these kits are more expensive than the rapid test kits.
The number of positive patients in the state has gone up to 1,242, and various reasons have been given so far, claiming that the kits have not arrived in the state. The first one being the delay in the flight, and the most important one being that the Chief Secretary itself coming forward and saying that the consignment was actually rerouted to the United States of America. Now the Health Secretary once again has come forward and said that they are not planning to wait for the RT kits, and they're going to use the RT PCR test. This is the actual test which is used for the confirmation of COVID-19 infection, and this test actually takes a lot of time. If RT kit takes half an hour for confirmation or primary confirmation, RT PCR test actually takes a minimum of 6 to 7 hours. But even then, this is more reliable, and the Health Secretary claims, and the Health Minister also says that they have 1,60,000 kits in their hands right now, and they are planning to use it for, they have already created 558 containment sectors across Tamil Nadu, and they are planning to use this with the primary contacts, the secondary contacts, the family members, and the people who might have a chance who have had contact with them as well. So that's how they are trying to use the RT PCR kits. It's it's actually a bit more costly than RT kits, but unfortunately, since none has arrived so far, they've decided to go ahead with this one.